everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And today's guest is a good friend of the show and known for so long, seen at hundreds of conferences, it feels like. But she's Robin Farmanfarmaian. She's the author and professional speaker of a new book called How AI Can Democratize Healthcare. Welcome, Robin.
I am so excited to see you. I haven't talked to you for a few months, so this is awesome.
I
feel
know.
like it's catch up.
It's like I need to travel to more conferences or something. Yeah, I'm blaming COVID. So for those that don't know you, tell us a little bit about yourself.
So I'm an early stage entrepreneur, professional speaker, and author in cutting edge healthcare technology. My first book is The Patient as CEO, came out about 5 or 6 years ago. And now this is my new book, How AI Can Democratize Healthcare.
Nice. I love it. And fun fact that she was with the ballet. I mean, anyway, I know too much about you. So that's my favorite secret. Like, we like fun facts here on the show. So tell us about this new book. You co-authored it with Michael Ferro. Give us an overview of what is in this book.
Oh, it talks about all the really cool things. So things like digital therapeutics, which is using an app that is typically by prescription in conjunction with other medical interventions like therapy and medication. So you can see like a pharma company maybe having a companion app. We dive into AI voice technology beyond your Amazon Alexa, which is HIPAA compliant, into the world of vocal biomarkers, using a patient's voice as an actual vital sign, right?
Yeah,
then we go,
absolutely.
Isn't that the coolest thing? Thinking about that, it's AI voice technology. One of my favorite applications is the ability to count the number of times someone coughs on a daily basis.
I'd have it a lot because of my allergies. So that makes sense.
Exactly. I mean, think about that for a second. Imagine I had a chronic cough and I went into the doctor and the doctor said, okay, Robin, well, how's that new medication doing? Are you coughing less? I said, I think so, doc. And the doc says, okay, well, how many times did you cough yesterday? I don't know, 12, 40, 300. Like, we don't know. And just the ability to count the number of times someone coughs on a daily basis is a game changer.
Yeah, that's amazing. I mean, we had Ellipsis Health on here talking about some of that as well, right? Listening to the voice to understand your emotional state, right? And giving, to understand depression, anxiety, similar stuff as well. It's so fascinating how quickly this is moving though, right? Give us some other examples. I think that's one of my favorite things when I hear you speak is you like rattle through like 60 different examples of like cool things that are happening. So how real is this AI in healthcare? And give us some specific examples like you just did.
Oh, okay. So thinking about wearable tech and clinical grade sensors, we're seeing a lot of wearable technology really go through the FDA as a class 2 or a class 1 medical device, including things like, getting your single lead EKG, your blood pressure monitor, and things like that. Well, there's a company called Vital Connect, and they have a single lead EKG that sticks to your chest, and it records your continuous blood pressure monitoring and EKG for 24 hours. They are able to predict with 6.5 days advance notice of a cardiac readmission.
Wow.
That is it's jaw-dropping incredible. And then a company that I'm on an advisory board for is Alacrity Care. It uses Omron's blood pressure monitoring watch that is around here, as well as the Oxytone, which is a pulse oximeter watch using PPG technology that reads pulse oximetry, blood oxygen through the wrist. Now they are able to take that kind of data and combine it with telemedicine 24-hour oncologist practitioners to be able to catch neutropenia, cytokine storm, and sepsis days, if not a week earlier for things like oncology problems. These things save lives, right?
Yeah, absolutely. Well, and I think what's fascinating is the sensors matter, right? Getting all that data. But when you look at it, like if we have all that data and gave it to a doctor, I mean, our doctors are already overtaxed and there's too much data for them to process. Maybe is that why this book is about AI and not about sensors, is because the AI is required to make the sensors valuable? Is that how you see it, or what's your perspective on this?
Exactly. Okay, so thinking about pulse oximetry using PPG technology. So at the end of your finger, we all know how to do the blood oxygen levels that way. PPG technology was invented in the 1930s, and then it was commercialized in like 1982. We are now finding entirely new ways to utilize PPG technology through things like the wrist, through the chest, as well as leveraging smartphone cameras and laptop cameras. And so companies like Anura use PPG, what they call it transdermal optical imaging, a simple light source sent through the skin, right, in 4 very specific places, and they read the red blood cells. Now, the fact is, we've been doing that for years, but they are now able to do that because they have the algorithms behind the scenes to be able to interpret it.
Interesting. So is that why you call it? I mean, the book is called How AI Can Democratize Healthcare. Like, help me understand, how does AI help to democratize healthcare? And I imagine there's a lot of international impacts here as well.
Exactly. So thinking about the fact that companies like Facebook and SpaceX and Google are really democratizing the internet already, right? We're seeing them do things all over the world to make sure that, all close to 8 billion people are actually connected. And so that's what you need to be able to utilize AI to democratize healthcare. And so piggybacking on all these giants that are really enabling connectivity worldwide, we can go from sick care to continuous care. Meaning we're going to have your environment, your clothing, subcutaneous sensors that are able to track you 24/7 and catch problems early, even at like stage 0, way before they become an actual problem. And so, I mean, even thinking about like an African farmer today has more computing power in the palm of his hand than, say, most presidents did in our lifetimes just a few decades ago, right? And so being able to piggyback on that technology using AI voice technology like vocal biomarkers, things like digital therapeutics, the wearable tech that's able to then give the data that the AI can analyze in real time and say, oh, your blood oxygen level is low, or your EKG is off.
Yeah. I think this vision of continuous monitoring is exciting, a little scary for me in knowing my health, but I'll set that aside for a minute. But it also sounds expensive, right? Like, who do you think is going to pay for this evolution of it, towards AI and sensors?
So it sounds like it would be expensive, but if you think about it, if you are, say, in a very remote location and there's a bunch of people, you only need one smartphone, right? And like, if you can leverage the smartphone camera to do things like blood pressure, heart rate, and heart rate variability, right? Like, you don't need that much more when you're talking about a vital sign. And then you could also outfit like one clinic that serves, 500 people in a remote location with like technology like TytoCare. So TytoCare is a direct-to-consumer telemedicine kit that has clinical-grade device applicators for an otoscope, a stethoscope, and things like a tongue depressor to look down the throat. They hook onto a video camera that can be done asynchronously, which means you can record like the inside of your ear or down your throat, or it can be done in real time with a healthcare professional over video who sees the live video camera feed. So outfitting a clinic could cost less than $1,000, and suddenly like thousands of people have access to that care.
Yeah, I think it makes sense in the underdeveloped world, where the reality is they just might not get care, right? They just might not get access to it. It'll be interesting in the developed world. Will it undercut other medical devices, or will it be the wave of value-based care that we've all wanted? That we needed the data to be able to do value-based care completely. I don't know. That's going to be different to see play out revenue-wise, right?
Yeah, and it totally depends on what you're talking about, right? So when you're dealing with, say, Viz.ai, that is AI that does stroke detection. and it's able to figure out if you've had a certain type of stroke. I think it's an LVO stroke. And if you do, and that's used in the emergency room to detect that type of an LVO stroke, all of a sudden it qualifies for Medicare as a new technology add-on payment, because it diagnoses the patient more quickly. And then that same patient is then going to have probably a thrombectomy versus a medically managed stroke. And Medicare covers that, right? And so we're seeing Medicare cover things like those types of applications. They also now cover CBT-related digital therapeutics for behavior change. CBT is cognitive behavior therapy. And this is really a gold standard when you are talking about anything to do with behavior change. And so companies like Pear Therapeutics have 3 clinical grade FDA cleared digital therapeutics around things like addiction and insomnia. And they now qualify for that CMS reimbursement.
Yeah, impressive. So when you look at AI, right? I mean, you've literally written a book on AI, but like, as you look at it, do you see it as a kind of ongoing progression of tech in healthcare, or do you think it's going to create some fundamental shifts that we should be aware of?
Oh, it's already creating a fundamental shift. Of course, that happens with the regulatory environment as well as the consumer space and some of the big players like like United and Cigna and Humana and Anthem. I kind of look at what some of the big payers are doing, and they are all shifting care to the point of the patient, meaning typically at home. Everything from dialysis. CMS and Humana have been making a big push to have dialysis in the home now for like 4 or 5 years. We are talking about things like IV medication done in the home. I get my IV Remicade at home for Crohn's disease. When I got it done in the hospital, it was $28,000. Getting it done at home, $2,500. Over a 5-year period, that comes out to a difference in billing of $1 million. And so we are seeing a lot of the giants shifting care to the point of the patient. We're seeing companies like CVS, which, as a reminder, they are a retail pharmacy. They are a pharmacy benefits manager. They own like 9,000 stores across the United States. And of course, they're now one of the biggest private payers. And so they are shifting things to the actual store as well. CVS, Walmart, Walgreens are all really upping their game in chronic disease management care, things like diabetes and high blood pressure.
Yeah. Well, Robin, this is amazing. I think you're one of my favorite people that brings the joy into healthcare, and that's what I felt like, hearing the exciting innovations that are happening that you've seen and can share with others. So, where can people go to learn more about you, and also, of course, buy your book?
So, of course, it's going to be on Amazon September 13th, and you can go to our website, democratizinghealthcare.ai.
Awesome. Well, Robin, thanks so much. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, Robin.
Thank you.